My little brother Michael was diagnosed with type 1 diabetes when he was 12 years old. At first we hadn't really noticed anything was wrong. He was losing some weight, was always really thirsty, and would eat a lot, but we just kind of assumed it was because he was going through a growth spurt. But after a while, the symptoms started to get worse. He had gotten so skinny that you could see his spine. My mom had had a history with diabetes, and so she knew the symptoms to look out for. And so she decided to test his blood glucose levels. When she saw how high they were, she rushed him to the hospital, and that's where he stayed for the next week. In this case, we were lucky. My mom knew the symptoms of type 1 diabetes and was able to catch the problem and get him the help that he needed. However, in many cases, people don't realize that something is wrong, and this could have life-threatening effects for the person with the disease. Type 1 diabetes is a very serious disease, and understanding what it is, being aware of the symptoms, and knowing the risk factors could ultimately save a person's life. In order to fully understand what you're looking for, you must first understand what the disease is. So there are two different types of diabetes. There's type 1 and type 2. Type 2 is a more common form of the disease, which is usually a result of obesity or unhealthy eating. With type 2, your body either makes too little insulin or it doesn't know how to use the insulin efficiently. Type 1 diabetes, on the other hand, is an autoimmune disease. This means that your immune system, which is the part of your body that's supposed to be fighting away disease, is actually what is causing your diabetes. So what happens is your immune system begins to attack the cells that are in your pancreas that produce insulin. And without the insulin, your cells no longer receive the energy that they need in order to keep them running. So when your cells can't function properly because they don't have the energy that they need, your body starts to have negative reactions. There are many different symptoms to be aware of. When it's still really early in the disease, the symptoms that a person would be experiencing would be constant thirst, peeing more than usual, extreme hunger, weight loss, fatigue, or nausea. However, it's really easy to miss these symptoms, and if you do miss them, they become more serious, and that would be things such as short and fast breathing, loss of coordination, a pain in your stomach, shaking, slurred speech, and a fast heartbeat. So right now you may be asking yourself, well, how do I get type 1 diabetes? Type 1 diabetes is a disease that slowly starts to present itself over time. And it's not clear to scientists right now what the cause for type 1 diabetes is, but they suspect that it has a combination of factors due to a person's genetics and their environment. So if you have a parent or a sibling with type 1 diabetes, you are actually 10% more likely to have the disease. It is also more common for males and Caucasian youth to have type 1 diabetes. And the disease can be triggered by a virus or specific types of chemicals and drugs. Because there's so little known about how the disease is caused, it's hard to say how to prevent it. It's important for you to maintain a healthy diet and to exercise. Although this cannot prevent you from getting the disease, by having a healthy body, if you do end up with type 1 diabetes, it'll be easier to maintain it. It's scary to think about the possibility that you or someone else you know could have diabetes, but it's important for everyone to keep an eye out for it. By understanding what the disease is, being aware of the symptoms, and knowing the risk factors, you can ultimately save someone's life. Diabetes is a very common disease that can have a very serious and possibly life-threatening effect on people. Unfortunately, many people don't notice the signs fast enough or are unaware of what they should be looking for. If we had not been aware of my brother's symptoms and not taken him to the hospital when we did, he could have died. No one should ever have to face losing someone they care about because they didn't know what was wrong or how to help. Any questions? Matt?
So, you said your mother got diabetes in her life. Has anyone else gotten diabetes in your family?
So my mom had it when she was pregnant, which is another form of diabetes that you can have. Other than my mom and my brother, my grandma has also had type 2 diabetes. Any other questions?